Gastric cancer is the fifth most common type of cancer and the third leading cause of cancer death globally, with over 1 million new cases and 780,000 deaths in 2018 alone. The disease is around twice as common in men as it is in women, but rare below the age of 50. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about how gastric cancer survival is connected to marital status of people. Marital status is likely to be an important contributory factor in predicting long-term survival in people with early-stage gastric cancer, suggested a research published online in the Journal of Investigative Medicine. It should be added to the usual list of clinical and personal variables used to inform how long a person is likely to live after diagnosis, say the researchers. The prognostic value of marital status has been recognized for people with cancers of the liver and the lung. It isn't included in the list of predictive survival factors for early-stage gastric cancer. The researchers took clinical information that has been entered into the surveillance epidemiology and end results database from 3,647 patients diagnosed between 2010 and 2015 with early-stage gastric cancer that hadn't spread beyond the stomach to other parts of the body. The following variables were included: age at diagnosis, race, gender, tumor site, molecular findings, that is histology, grade, that is appearance of cancerous cells, spread to the lymph nodes, which is stage, surgery, lymph node removal, chemotherapy, radiotherapy, tumor size, insurance, and marital status. Some 1793, that is 49% of the participants were men, and 1854, which is 51%, were women. Most, that is 2231, were white. In all, 1957 were married and 274 were divorced, 41 were separated and 630 were widowed, while 512 were single and marital status wasn't known for 233. Overall survival prospects were better among women than among men and among people who were married. In the training group, people who were married had the best prognosis, average 72% chance, while widows had the worst, average 60% chance. Similarly, when gender was taken into account, the chances of survival were highest for married men, that is average 69%, and married women, average 76%, while they were lowest for widowers, average 51%, and widows, average 61%. Survival was also significantly better in divorced women than it was in divorced men. The researchers concluded that all patients diagnosed with early-stage gastric cancer can use their nomogram to assess their prognostic risk after receiving corresponding treatment. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.